Welcome, good morning, good afternoon, depending on where you're calling in from. I really want to say a special thank you for everybody to be able to prioritize spending your time on this webinar. I know there are many things happening in our world today that might have taken precedence. So thank you so much for being here. On our webinar called Where Are the Babies? Exploring Family, Friend, and Neighbor Care. My name is Ronna Schaefer, and on behalf of the entire State Capacity Building Center Infant Toddler Specialist Network, I really want to thank you again for joining us. We're so delighted that you could be here for the first of our three-part series of webinars. You can sign up for the other two if you haven't already in the same way that you were able to sign up for this webinar. I also want to let you know that we are recording this and you will be sent a link to the recording, a PDF of the PowerPoint, and a certificate of participation if you need that. So before we begin, I'm going to turn this over to my colleague, my tech support person, Violetta Mora, to walk you through some of the features of this platform. Violetta?
Thank you so much, Ronna. Welcome, everybody. Thank you for joining us. I just want to do quick housekeeping. You will notice to your left, there is a chat. You could use this to say hello, enter comments, enter questions, anything. You can go ahead and type that. If you accidentally close something, the icons at the bottom will open them back up. You will see there's an icon for the chat. There's also icons for handouts, and you'll be able to access those through the webcast. And again, welcome. Thank you so much for joining us. Ronna, back to you.
Thank you for all that. Again, if you have any questions, put them in the chat pod and we'll help you through any tech problems you may have. So in the next 90 minutes, we have really two objectives. The first is to identify the unique aspects and the value of family, friend, and neighbor care. You'll have lots of opportunities to weigh in through polls and through questions that we pose to you that you can respond to in the chat pod. I also welcome you to continue saying hello in the chat pod like you're doing, so we see all the different places you're calling in from, and to pose questions to each other so you can have a conversation in the chat pod. So after we explore some of the background and the national scene on family, friends, and neighbor, we'll move to our panelists. We are fortunate today to have 4 panelists, 2 from Washington State and 2 from Colorado, who will share some of the innovative strategies they're using to support family, friend, and neighbor professionals. You'll also have opportunities to tell us what you're doing. I also want to thank my colleagues from the Infant Toddler Specialist Network who helped to develop this, and from the National Center on Early Childhood Quality Assurance, who also contributed to the development of this webinar. So with this, I'm going to mention that, again, my name is Ronna Schaefer. My colleague, Deborah Greenwald, will also be hosting and presenting on this webinar today. And she'll introduce herself in just a minute, but we want to know who's with us today. So in just a moment, we will pull up a poll. And although I know you wear many, many hats, we're hoping that you will just choose the role that you spend most of your time, your professional time on. So here's the poll. Please enter your responses, and I'll share those responses with you in just a couple of moments. I see a lot of you are beginning to enter this. Again, I will share this in just a moment. What I'm seeing here is there are a number of folks who are state agency staff from CCDF and licensing, a number of people from child care resource and referral, some quality rating and improvement leadership. All right, I'm going to share this with you. It looks like most people have weighed in. And again, we're delighted to see so many people with different roles on this call today. And we hope that you will share your thoughts and your ideas. If you do have something other, I see some of you do, and you're putting it into the chat pod. That's fantastic. Thank you very much for doing that. So let's get started. I'm going to turn this over to my colleague, Deborah, who will give you a bit of the background.
Thank you, Rana. Welcome, everyone. I work with Rana on the Infant Toddler Specialist Network at the State Capacity Building Center, and we're always interested in babies, and we jumped at the opportunity to think about this topic together and with our panelists and with you. So I'm going to just share some of the context and background and definitions to get us started. But first of all, let's think about those babies that we know in our lives and where they're spending their days and nights. So we're going to just have another poll to look at. Where the babies are, where families choose to have their children cared for. So are they with parents at home, the babies that you know in your life, grandparents, extended family, friends or neighbors? Do they have nanny care? Have they found family child care? Early Head Start programs, early intervention. I'm seeing quite a mix across the board, actually, from our participants. We have 160 people logged in right now. Looks like most people have weighed in. So this is what we're seeing, that a lot of babies are home with families and with grandparents. We know that a lot of children are home right now due to circumstances, but we are thinking about where they are on a typical work and school day. So we see that there are a lot of children are with their grandparents and their families. It looks like a very similar number in family child care and center-based care. In-home care with nannies, lots of children in family, friend and neighbor care, early Head Start. And for other, I'm looking over here, is that Adrian? Maybe Educare, an Educare program. We did not list that on there, so thank you for sharing. Okay, thank you. So let's look at some definitions of how the different types of care are defined. So home-based childcare includes both licensed regulated family childcare homes as well as license exempt care. And this definition on this slide, licensed family childcare, is defined as one or more individuals providing care services for fewer than 24 hours a day, unless in some cases work requires excess of 24 hours. And the care is in a private residence that is not the child's family residence. And so that's what the overview definition of licensed family child care looks like. Licensed exempt care is, okay. Family childcare homes that are not required by statute to be licensed are referred to as license exempt. And it typically means the number of children in care who are not related to the provider is less than the state licensing threshold, which is often defined by the number of children in care. And family, friend, and neighbor care has many different names, including informal care, home-based care, kith and kin care, relative care, legally unlicensed care, and license exempt care. And license exempt is an umbrella term that we use to describe that type of care. And family, friend, and neighbor care is home-based care in either the caregivers or the child's home, provided by caregivers who are relatives, friends, neighbors, babysitters, or nannies. And the definitions for family, friend, and neighbor care can overlap sometimes and be confusing. The term for family is not exactly the same definition as what we would find in the Child Care Development Fund, which defines family very clearly. The definition for family in FFN care is broader. So when we talk about FFN care in this presentation, we're referring to care provided by both relatives and non-relatives. Home-based childcare is a critical component of our early care and education system, as everyone on this call knows. And according to this survey, National Survey of Early Care and Education report in 2016, an estimated 7.1 million children aged birth to 5 spend time in home-based childcare settings. And that number includes both licensed and license exempt providers. The largest subset of home-based providers fit the label of, which is 2.7 million, fit the label of family, friend, and neighbor care. These caregivers combined care for more than 4 million children. Compare this number to 3.8 million children who receive care in childcare centers. The report also points out that about half of home-based care providers are located in moderate or high poverty areas, and less than 1/3 are paid for providing the care. This report also makes the point that there's a need to focus on all aspects of home-based childcare, including license-exempt family, friend, and neighbor care to ensure parents and families have access to high-quality care. Nearly all of these providers had a prior relationship with the children in their care, so the families know them ahead of time. On average, they care for 2 children a week in either their own or the child's home, and the majority of these unlisted, unpaid providers fit the label of FFN care. Why support family, friend, and neighbor caregivers? Because that is where the babies are, as we just saw through the results of that report, and as many of us know through our daily lives. Family, friend, and neighbor care is by far the most prevalent form of care for children from birth to school age. And most states have a number of childcare programs operating without regulation. And these programs include both relative and non-relative caregivers. This really makes a case for using resources to support this group of caregivers and the children in their care. What does quality look like in home-based childcare? Well, it depends on who you ask. So despite the widespread prevalence of family childcare providers, there's little research on quality in licensed family childcare. And the research that has been conducted has reached mixed conclusions. Some studies report low levels of quality in family childcare settings, while other studies have found high levels of satisfaction among mothers of children in family childcare. And a belief that home-based care provides a safe, warm, and healthy environment for their child. Regardless of the setting, infant and toddler group care studies indicate the need for strengthening quality. However, we do know that many infants and toddlers are in home-based care, and research shows that 93% of childcare programs are rated as providing low to mediocre quality of care for infants and toddlers, in comparison to 75% of center-based programs, which are rated as providing low to mediocre quality care for infants and toddlers. Part of the discrepancy in the results might be related to the fact that many of the assessment tools have been designed with center-based care in mind. And there may be a mismatch in measuring when looking at family childcare, and that's something where we need more data. The contrast between parent satisfaction and quality ratings is interesting, and it really warrants a deeper look. And I'm wondering if people have thoughts on that, if you'd like to comment in the chat about this discrepancy and parents feeling comfortable with the care when the assessments are showing that it's not high quality. Does anyone have any thoughts on that they want to share? If you do, you can type in the chat. Thank you, Alexa, pointing out the chat. And people are keeping their thoughts to themselves, so we'll continue. Why do families choose? Okay, some responses are coming in. Parents might not have experience with quality. Oh, wow, it's going quickly. They might not be looking for the same things that the assessment tools are looking for. Home-based care can manifest deeper relationships, and maybe that contributes to parents' comfort. So that includes continuity of care that's built over time, maybe caring for siblings together. Parents choose care that looks and feels like home. So that's definitely true. Maybe home language is shared, culture is shared, same neighborhood. And I like this comment from Megan, parents tend to see quality with a relationship. And Holly asks us, if we're doing a good job measuring family child care and honoring culture with our measurement tools. So I think that that's something that we do need to consider. So sometimes people just choose because they don't have other options, and they care about how they feel with the teacher and how their teacher makes the child feel. So lots of important suggestions here that I think you'll see echoed in some of the data that I'm going to share. So parents may not be looking for the kinds of things we're looking for in the field, like facilitating brain development through interactions. They might be looking just to know the child is safe and clean and cared for and fed, which are all extremely important things. So we do have different lenses depending on our world that we come from. Thank you all. Okay, so let's look at the data, which really echoes a lot of what you had to say here. But one of the reasons families choose FFN care is preference, such as that shared language, culture, and values, which is going to be particularly important for families who don't speak English or have limited English. Affordability drives many of our choices. And knowing that, go back to affordability, that family childcare is often more affordable than center-based care. And research shows that families are more likely to use family childcare when the average price of center-based care is higher. Also, families might face challenges such as waiting lists for Head Start or other early care and education programs, and lack other affordable alternatives. Proximity is a really important factor, particularly if families rely on public transportation. And we all know that families tend to choose childcare that's close to home or work, depending on which is more convenient. In addition, many family childcare homes and Family Friend and Neighbor Care offer flexible hours. So if you have shift work or need childcare overnight or weekends, so you can get to work, those flexible hours are going to be key. And many families prefer the continuity of care that comes along with being able to have siblings together in those programs. And a lot of times there just aren't enough options. So to choose licensed or regulated care, and those, particularly those impacted by this, are in rural communities where there are fewer choices for childcare. I mentioned working non-traditional hours, And we also see that parents who have children with disabilities or delays or medical needs often seek care in family, friend, and neighbor situations, particularly if the child has equipment or therapeutic interventions that are required. And some parents have reported being concerned about the high cost of inclusive care for their child with disabilities or delays. And some have reported frustration that providers wouldn't administer medications or treatments, and that sometimes they feel like even though their child is in care, they may not be included in activities and have a sense of isolation. So, and many of these factors lead to their choices for family, friend, and neighbor care. So with all that information, much of which might have been familiar to you, what are your hopes and wishes moving forward for family, friend, and neighbor caregivers? We have created a poll with some suggested responses. And if you have other responses, I see that you're making good use of the chat box, so please feel free to contribute there as well. But do you hope to improve access, reduce turnover, to help move family, friend, and neighbors care towards licensing, support quality improvement? We see people responding across the board. Do we hope that providers are supported in ways that are meaningful for them? I see better pay for providers coming up as a hope and wish here. And one participant shares that her provider knows her children and loves them. And besides her personal relationship, she feels like having the low turnover and reinforces those safe and secure relationship. And she's also able to breastfeed and feel comfortable with that there. So that's super important. Okay, it looks like most people have shared, so I'm going to share the poll results. So you can see we have strong feelings, and we want all of these things to be built and supported. Access, reduction in turnover, so that children can have those safe, secure, continuous relationships. Movement towards licensing and quality improvement. Looking at health and safety in particular. And supporting the family, friend, and neighbor caregiver community to see themselves as important and included. And provide support for them in ways that are meaningful, rather than feeling as if something's been laid on top of what they're already doing. So thank you so much for your contributions. And now we have an opportunity. Rana's going to take us through some working with our panelists to hear from them some of their innovative approaches to this. Thanks, Rana.
Thank you. Thank you, Deborah, for all of that great background to really ground us on how important family, friend, and neighbor care really is to our families and to our children. And thank you all for all of your great comments in the chat box. I wish we could all unmute our phones and have this conversation, but unfortunately, it's really hard to do that in a webinar, right? But I saw a lot of you talking about supports in your wishes and your dreams. A lot of you talked about you wish that we could help family, friend, and neighbor providers see themselves as professionals. We could help them attain a higher level of compensation that they so well deserve, and that we have supports to increase the quality. And again, as Deborah said, quality is really in the eye of the beholder, right? Assessment tools may tell us one thing, and parents' preferences may tell us something different. But there is a need to support family, friend, and neighbor providers. And I think everybody on this call absolutely agrees with that. So I am delighted to introduce to you our 4 panelists who will be sharing some of the ways that their states, Colorado and Washington State, have come up with to support family, friend, and neighbor providers. And I know that's why everybody's on this phone and on this call, to really hear some of their ideas. There'll be lots of opportunities for you to share your ideas as well. Keep writing your questions in the chat pod. Keep having conversations with each other. So first, I want to introduce to you Sharon Morris from Colorado. She's the director of the Library Development in Colorado State Library at the Colorado Department of Education. And with her from Colorado is Vanjie McCoy. Vanjie is the director of the Montelores, I hope I pronounced that right, Vanjie, Early Childhood Council Coordinator. And from Washington, we have Judy Hadameo. Again, Judy, I hope I'm pronouncing that correctly, who is the Licensed Exempt Service Administrator at the Washington State Department of Children, Youth, and Families. And from Washington, we also have Victor Cardenas, who is the Early Learning and Family Engagement Manager at Catholic Charities serving Central Washington. So this will definitely be a panel conversation. I will be asking some questions of our panelists. We hope you will also ask some questions of our panelists. And they will be responding to some of our questions as well as your questions. So let's begin with some of these questions. I'm going to turn first to Sharon in just a moment and ask Sharon to talk to us a little bit about how they're doing outreach to family, friend, and neighbors so that they know about the programs and the supports that are offered through the library services in Colorado. So Sharon, I'm going to turn to you with some of that information.
Thank you very much for having me and in Colorado, we have a program called Growing Readers Together, in which we work with local libraries to identify and serve family, friend, and neighbor providers, focusing on early literacy in particular. And what we're finding in Colorado is that identifying FFN providers is often very challenging, and it can look really different in a small community, a medium-sized, and in larger suburban or urban communities. So the FFN themselves have different portfolios in different areas, and basically we really leverage the local public library and the people that work in the library to really understand their community, work with partners, do outreach events, go to pediatricians' offices, to shopping malls, have events in other places such as pop-up story time, to really try to go where people are and identify them as caregivers that are taking care of young children and helping them to see their role as teachers of the very young children. Because a lot of times, as indicated by the polling that we've done here, they don't always see the opportunities they have on a daily basis to really engage with children. So that's kind of a brief answer, but along the way also, just talking with people informally in the library and getting to know who they are and how they care for the children that they're serving, and offering resources for them, both in the library and also out in areas with partners and in outreach locations. So I'll hand.
Thank you so much for that information. I really love the way you talk about meeting people where they are, finding them in the pediatrician's offices, at the malls, when they're coming for story hours anyways, to really do that outreach, to thoughtfully invite them to participate in the opportunities you have. And as you said, see themselves as professionals, see themselves as teachers. Those are great ways to reach providers. And in a little while, we'll ask all of the participants to share some ideas. But right now I'm going to turn to Judy next and ask her two questions. One is to tell us a little bit about, in Washington State, not only how do they identify and recruit family, friend, and neighbor providers, but also what is the criteria for family, friend, and neighbors to receive any funding from CCDF if they can do so, and what do they have to do in order to receive that funding? So, Judy, I'm going to turn it to you for those questions.
Thank you, Rana. As Rana said, this is Judy Jaramillo from Washington State. And yes, our FFM providers are actually come to us when the family qualifies for assistance, pay for childcare using CCDF funds. Once the family has applied and is approved to receive assistance, they let us know if they want to use a family, friend, or neighbor provider. At that point, they come to our division, they register, they submit an application rather, and we work with them to get them approved. They have to do an intensive background check, but we encourage providers to do training. Our non-relative providers are required to do training, which is if they take care of infants and toddlers, they need to do safe sleep, along with all non-relative providers have to do health and safety training along with first aid and CPR. We don't do recruitment only because the providers are coming to us through the families, and we offer as much support as we can. We encourage all providers to take training. We have free trainings online that they're able to take as well. Hope that answered your question, Rana.
Thank you. It did answer my question. And it's really always interesting for me to hear how different states are qualifying non-registered or license exempt providers to be able to receive some funding. And what I'm hearing from you is that it all comes through the family and that the health and safety, the background checks are required as they need to be, as is required in regulation. So thank you so much for sharing that. So this was a bit of some background information that we wanted everybody to have. And before we move to our next set of questions, I'm going to move to a poll to ask all of you out there listening in, how do you recruit family, friend, and neighbor providers to some of the supports that you may offer in your state? You can select multiple options here. And if you have an other, please write in the chat some of the ways that you find family, friend, and neighbor providers. I see some of you are saying families that request funding, similar to what Judy had shared with us, that families come to you and say, I want my child to be cared for by this person. And that's the way that you find out about them. I also see that many are talking about the providers contact the agency because they're now caring for someone and they would like some funding, and notices in public places. So let me share those results with you. There you go. Now you can see them as well as me. I keep forgetting that I have to do that. I'm sorry. And I see a lot of you are putting some other things through CCR&Rs, family child care networks. It looked like somebody was saying family child care networks are now also reaching out to family, friend, and neighbor providers. I think that's an amazing strategy. I see at libraries and community centers. Some states are only providing funding for folks who are registered rather than license exempt, and we understand that throughout the country there's a lot of difference. So those answers are fabulous. I love all of the responses in the chat pod. I thank you for sharing all of those thoughts and ideas. And I hope some of you got some new thoughts and ideas. If you're not already putting notices in public places or getting referrals from people who you do know of, I hope you'll consider adding that to the strategies you're already using. So let's move to our next set of questions. So our next set of questions is really about how states are supporting quality sometimes through professional development opportunities, how they're engaging them in quality systems, and maybe even supporting them to become licensed or participate in QRIS systems. So here I'm going to turn it back to Judy to answer some of the questions about what is happening in Washington around supporting quality in family, friend, and neighbor providers.
Thank you, Rana. We really try to work closely with our providers to encourage them to take training. A lot of these providers are relative providers. The vast majority of them are. A lot of them are grandparents. And so we do let them know there are many training opportunities in Washington that they can take advantage of. There's lots of free training they can take, along with in-person trainings that are offered. And there are also, and Victor will speak to this later, in parts of Washington, we have some play and learn groups that are happening that FFM providers can participate in. We do try to point them in the direction of offering them resources that they can receive and utilize as they're caring for the children. Often it's lonely in their own home with just the children. So we do try to answer as many questions as we can for them and direct them to where they need to go. FFN providers are not regulated like licensing is, so we don't have as high an expectation of quality, unfortunately, but we do really encourage them to do the best they can with the children that they're caring for.
Thank you. So one of the things I heard you say was that, and correct me if I heard this wrong, but that FFN providers can participate in professional development opportunities that you're offering to regulated family child care providers, and that they can be encouraged to be part of all of the work that is being offered to them. Is that correct, Judy?
That is correct. Yes, that is correct. There are many training opportunities that they can take advantage of, but they are not. The only ones that are required to take training are the friend and neighbor providers who actually are required to care for the children in the children's home. And they're the only ones that are required to take health and safety training, first aid, CPR, and safe sleep. But all the others are highly encouraged to take any trainings that are available.
Thank you for that clarification. I just wanted to make sure that I understood and that everybody on the call really understands that. And Roxanne is also adding in the chat. Roxanne is also from Washington, and she's adding that in Washington, family, friend, and neighbors providers can access training that we offer to family child care providers. And they receive a compensation for this up to $750. She's added a website in the chat pod to see how all of this works. Thank you so much, Roxanne, for adding that information. We really appreciate it. And if there's other states that have information similar to that about what you're doing to support family, friends, and neighbors, if you have websites, please add them to the chat. We love to share this information among everybody. And you'll have another chance to share that in a poll and a chat in just a minute. But now I want to turn this to Victor. Judy mentioned that Victor is sort of oversees some play and learn opportunities. And Victor, I'd love for you to tell us a bit about the play and learn opportunities throughout Washington.
Hey, hello everybody. And I just threw in the chat there a quote that Maria, our associate director, threw in here a little bit more information about some of the other play groups that we offer across Central Washington. I do want to have a disclaimer that the group that I'm about to mention does not represent the view of the whole state or what's happening across the whole state. This is just a small area, well, relatively large area within the state of Washington, Central Washington. We serve about 10 counties. And the program called Early Connections Play and Learn Group is a model that has been developed here in Yakima, Washington. And we are beginning to practice and share since 2017. I'll tell you a little bit more about the stats as we go along here. So the group that social connections and pathways for a circle. Looks like I was on mute and there may have been a disconnection here, so I'll start over. The Early Connections Play and Learn groups, I want to make a disclaimer that it was not a representation of the whole state, if not a program that is developed here with Catholic Charities Serving Central Washington. And I'm looking at the chat here, it's a little bit distracting. But this is a group at the Department of Social and Health Services Community Service Offices that's leading the way with a new approach in early learning and child welfare integration. This partnership sets the stage for invaluable social connections and pathways for a circle of mutual support for young children and those in our communities who provide care for them. It also creates an opportunity to reach more of the otherwise missed 72% of Washington's children and families who are not accessing formalized early learning opportunities such as Head Start, ECAP, or licensed childcare. And you might be wondering, how many does that mean? Since 2017, and mind you, only 2 of the groups have been running for 3 years, and 3 groups started this year in about October and November, and a 6th group started about 3 weeks ago. We're looking at over 7,000 children and parents and caregivers that have come through the doors. And at least, like I said, the first 2 groups have only been running for 3 years, and the last set of doors that were open started opening in October, November, and then just 3 weeks ago. With this approach, we try to share opportunities to educate, serve, and support families with access to available high-quality early learning, health, and wellness opportunities. Just like one of our colleagues mentioned in Colorado, meeting families where they're at is very important. So that's why we chose a location where families are already in crisis. They're already looking for an opportunity to meet the needs that they have in front of them, and may not be, focused on early learning for their children. So some of the guiding principles are to advance the goals, to integrate early learning and child welfare for further strengthened families. So in case it wasn't clear enough, we are talking about the welfare offices. These offices might have different names across the country, but these are your community service offices where individuals are coming in to help meet their basic needs, looking for TANF, working childcare connections, subsidy for childcare, where your CPS offices are at. It depends on and varies from state to state, but Child Protective Services, oftentimes these are shared spaces for state agencies where families are coming through the doors and trying to access services, and whether that's cash assistance or through food stamps, those types of benefits. And if you have questions about that, please feel free to throw that in the chat. I'm trying to keep an eye on it. It's also a custom tailored approach to reach underserved children and families. Like I mentioned, these are families that are already in need that are coming through the doors. And it helps enhance access to services to meet a variety of child and family needs. We try to create a partnership program within an environment that increases open communication. It helps families mitigate toxic stress and model ways to de-escalate challenging behaviors with children and adults during their visits to a CSO. So what does this look like? This is a weekly group held 1 day per week in now 6 locations, and it's 6 hours per day and 50 weeks a year. So what that looks like is these offices have partnered with us and identified a space that we can borrow. So if you will, in-kind services, borrow the space. And it's a conference room basically. And we have staff that are minimum bachelor's level. When they're not facilitating these play groups, they're out here consulting in licensed childcare settings with from a diverse group. We have individuals with backgrounds in mental health, social emotional development, environments, really, really big focus on early learning, as well as all of them are also state approved trainers. So when these groups are going on, families have access to a wealth of knowledge and individuals who are very well versed in and aware of the resources that are available in the community, as well as early learning opportunities. So we want to try to help promote protective factors for family resilience while they're in there, and help with parents becoming great advocates and and supports for their children. So like I mentioned, these conference rooms that are borrowed, our staff go in the morning about 8 o'clock in the morning, completely gut the room, basically, take out all the tables, and bring in all of the materials to set up at least 5 play spaces with facilitated play opportunities for children and families who come through that would otherwise be exposed to whatever is in the waiting room, whether that's a television or individuals coming off of meth, what have you, and being able to come into the safe space and kind of hang out, de-stress, and have an opportunity to focus on their child and their child's learning. And they also get access to early learning opportunities and developmental screening that is offered using age and stages questionnaires. Any questions about this? Otherwise, I'll hand it back to Rona.
Thank you for that, Victor. I wish I could come out to Washington and participate in one of your wonderful play and learn opportunities. They sound fabulous. We do have a question from one of our participants. She's wondering, is there any cost to families or providers that participate in the play and learn opportunities? And I also, when we give it back to you, you mentioned that children can have ages and stages screenings for development and social and emotional. I am curious to know who is doing that screening, if it's an FFN provider that is there with a couple of children from her home and she's not the parent. Can that screening still happen, or does it have to be a parent? So I'm going to turn it back to you, Victor, to answer those 2 questions.
Those are great questions, and thank you for bringing that up. So there is no cost to families. These are programs that are developed in-house and funded through different funding sources. And there is a book provided to each child who attends the group. The children that are coming through, majority of them are coming through with a family member, a caregiver, parent. And of those 7,000, at least 10% of the children are coming through would be coming through with individuals who are family, friend, and neighbor. So the people that are completing the ASQs are the parents. The ASQ itself was developed with research backing up parent report or caregiver report. So they, either the direct biological parents or guardians, whoever the children are living with, are filling out the ASQs, or a FFN caregiver. And if families aren't ready to fill it out, or they just don't happen to be in the space long enough to complete the ASQ, we encourage families to take them home, take them with them to their appointment while they're waiting, fill it out and bring it back to us so that we can go over it with them. So the individuals that are reviewing and scoring the ASQs are trained. Actually, some of them are trained the trainer level individuals for the ASQ itself. So they are definitely getting a lot of attention and perspective and support from facilitators as needed. Did I answer all those questions for you?
Yes, you certainly did. Thank you so much. And there was a question in the chat that I think was also answered by one of your colleagues about the children given a snack while they are there. And yes, it looks like Maria has added that they get a snack and drink. Thank you, Maria. It's great when we have colleagues of the presenters and the panelists on the call with us too, so they can answer some of the questions. Thank you, Victor. Does anybody have any further questions for Victor? Just put them in the chat room and I'll try to come back to him in just a moment. But now we're gonna get on a little travel and go from Washington to Oregon. And I'm gonna turn first to Sharon in, I said Oregon, I'm so sorry, Colorado. I'd like to go to Oregon, but right now we're going to Colorado. So sorry about that. So I'm going to turn back now to Sharon to ask her for some information about how they at the libraries and other professional development opportunities are happening for her. So Sharon, I'm going to turn it over to you.
Thank you. It's Again, great to be with everyone. I put in the chat area a connection to our program, which is Growing Readers Together. However, as with Washington, Colorado has a variety of different organizations that are working with FFN and pathways to licensure. What we're trying to do, and we get funding for through private foundations so far, is to really get a sweep, particularly in the rural areas of FFN, in ways that they don't necessarily have as many opportunities as they do in urban settings for support for licensure. So the way we're doing that is through that informal network that happens when people come into the library with their young children for story time. And we encourage libraries to have informal caregiver cafes after the story time so that those caregivers can meet informally, talk with each other, have those one-on-one conversations in some cases with each other and with the library, to gain some knowledge and understanding and ways to make them more effective in the daily life with their children. Along with that informal situation, libraries are also scheduling Ask an Expert events that coincide with story times as well. So those are they will bring in experts on different child development topics that will be in the library so that people can, again, informally ask those experts questions about development, about child health needs, and those kinds of things. And then in addition, we're beginning to do more what we call play, learn, and grow events in libraries, which again have centers set up where caregivers can engage with their young children and then take away materials that they get to keep in their home for early literacy, early learning kinds of things that can happen on a daily basis. We also have created an early literacy calendar that can be put up in the home for daily early engagement and learning activities, craft ideas, and other ways to really engage on a daily basis with the children in their care around literacy topics. So it's a variety of different individual coaching as well as informal and formal networking among caregivers so they can build networks locally and really start to understand their role in growing learners regardless of their age through the public library and also in partnership with other agencies, again, as I said, in outreach settings. So that's kind of the quick on the various ways that we're kind of reaching those family, friend, and neighbor caregivers, particularly the ones that aren't really ready to understand their circumstances as the possibility of reaching into a licensed situation. However, in Colorado, we do have a pathway for people who are informal caregivers that want to get licensing. They can attend training in online as well as in person and move towards licensing.
Thank you for that information, Sharon. I noticed earlier you had said, and again you mentioned here, how it looks different in different communities, that there are the outreach and the opportunities in the rural areas might look a little bit different in the more populated areas. And I think that's really something important for us to think about. We know that often in rural areas, FFN providers is really the only option for many families. And it's really important that we find strategies that meet them, again, where they are out in the communities, out in their rural areas. So I really applaud that you've really thought a lot about how it needs to look different in different communities. I'm also heard you say two things that I'd like to explore a little bit further, if I may. One is you talked about the parent cafes. And I love that idea. And I'm wondering where the children are when you have speakers coming in to talk to the adults about literacy opportunities or other child development opportunities. And you also mentioned something about some individualized coaching. And I'd like to hear a little more about how that works.
Sure. I'm happy to talk a little bit more about the Caregiver Cafe and also the Ask an Expert. So typically what happens is there'll be story time, maybe a dance party if they're toddlers, in which caregivers are with their children and engaging in activities. And then after that time, the children are usually with some library staff doing maybe an art project or just really active play in the library while the caregivers are in a different area getting to know each other or talking to an expert. So those things are happening simultaneously, and the children have the ability to engage in social emotional kinds of activities with other children their age in the library setting in kind of an open environment. What we're seeing, I know a lot of people are talking about during the pandemic, and one of the unfortunate situations that we're seeing right now is that libraries are having to close and not offer those programming. What we have been able to do through these programs, we think is really important, is, as I said before, give the caregivers materials they can bring home and have in their home that they own and the kids can engage in. And then we also have kits of early literacy, play, learn, and grow activities that they can check out and bring into the home to engage with the kids. So those additional materials beyond books, I think, is an essential way to continue the learning and the development while they're in their homes. I'm sorry, I'm not really remembering, I'm sorry, the second question about how this looks for our program. Rhonda, could you remind me again of that?
Of course. So you had mentioned that the providers or the caregivers could participate in some individual coaching. And I'd like to hear a little more about that. Is that something that happens during their time there, or it might be a follow-up for that?
Yeah, so if you've been in the library, you know that there are those opportunities for informal conversations after formal story times, or even when people are coming in with their children. And librarians tend to take the opportunity to just develop a relationship with each individual, whether it's a parent or a caregiver, particularly with a young children, and just help them to become more aware individually of some of the developmental guidelines and resources that are available to them, maybe help them to connect with agencies that they may not know about. And so those are just really informal conversations that happen both in the outreach settings when people are out and about doing pop-up story times and then having individual conversations with people, as well as in the library. And we really encourage that with the library staff, to have the skill set and the understanding of early childhood to be able to talk individually, and when they're seeing a parent and a child and understanding what those individual needs might be in that moment, and be skilled enough and knowledgeable enough about agencies and organizations in the community that parents and other caregivers may want to connect with in order to have their individual needs met at that time. So, it's happening all the time, informally, one-on-one, and I don't have specific examples. Well, maybe I do have one of a librarian who basically was talking with a mother of a young child who seemed to, in story time, not be as able to focus during the story time and to feel some disruption, and was able to talk with that parent and even tell her own story about her child who had been diagnosed early on with some autism spectrum indicators, and not to be alarmist, but just to sort of tell her own story and to talk about an agency that she was able to bring her own child to have some kind of testing in order to understand what was going on to get early prevention going. So those are the kinds of things that are happening informal in the library settings throughout the state.
That's great that you're taking advantage of every opportunity to increase the understanding of both parents and family, friend, and neighbor providers about child development. I love that example. And I really love that there is opportunity for them to take those kits back into their homes to use them there as well, because especially for family, friend, and neighbor providers, we know that there's not a lot of funding for them to purchase materials. So it's really great that you're able to help provide some of that for them. So thank you so much for sharing all of that information. I'm going to be checking the chat to see if there are any additional questions for you, and I might come back to you. But at this point, we're going to turn to Vanjie. And just to remind you, because it's been a little while since I introduced her, Vanjie McCoy is the coordinator of the Montelores Early Childhood Council in Colorado. So Vanjie, can you tell us a bit about what that council is and how you, within that council, are supporting quality for family, friend, and neighbor providers?
Yes, absolutely. Hi, everyone. I'm happy to be here. In Colorado, we have a system of councils. I serve 2 counties in rural southwest Colorado, and there are do a lot of the things that we've heard others talking about, but we are there to fill in gaps that other programs are unable to provide. So we do a lot of partnering with our libraries, and our library is a participant of Growing Readers Together. And so we do a lot of those activities. One of the newer things that we're doing that's exciting is we are tagging along with our WIC van and doing pop-up preschools out in outlying areas, because we are rural, we are stretched out, and it's hard for people to get to a lot of the activities that are happening in our larger populated areas. And we do things like a big annual event that we call a children's festival that includes free developmental health and health screenings and lots of different resources. Everything that we do, we open up to the community, whether they be parents, family, friend, and neighbor caregivers, or licensed. A lot of money to go around, and so we want to help people however we can. We do an annual conference regionally. We do provide coaching for quality improvement to licensed centers, and our neighboring council is our CCRNR, and that's where folks are really assisted to formal licensure. We have lots of communications that go out between social media, newsletter. We have an app that we're a part of that gives local information. We create school readiness calendars that have activities for the various learning domains. We have resources that folks can check out, similar to what Sharon was talking about with libraries. And we have the ability to direct people to the appropriate resources when they have questions. I did notice in the chat box that Jessica said that she was on looking for ways to contact and connect with FFN providers. And I think that's true for all of us. I saw someone also mention that so many of these people are afraid to come out because they think they're doing something wrong. And it's really all about building those relationships so that they can trust that you just want to help provide the best quality care for all children that you can. And I don't know if I mentioned, we only have slots for 34% of our birth to 5 children, even less for infants and toddlers. And so FFN is a really big deal here. And so doing this right is very important. Any questions?
So Vanjie, thank you for describing to us some of the great supports that you offer and include family, friend, and neighbors in. I also heard you say that if there is someone who is currently a family friend and neighbor provider and would like to move into licensure, there are ways that you can connect them to supports within your state to help with that. And thank you also for answering Nicole's question in the chat pod about really helping FFN providers realize that they're not going to be reported, they're not doing anything wrong, they're not going to be shut down or closed. I think both you and Sharon mentioned a lot about relationships, and I think that's so important in all the work we do. Obviously, we know that relationships with children is key, but relationships with the folks who are providing care to children is also key in quality. And from what all of you have said, it really shows me how important those relationships are, especially with family, friend, and neighbor providers who are not doing this formal care, who are just, folks who maybe haven't gone to school for this topic and don't see themselves as professionals. The importance of us to really develop those relationships is a key piece. And I'm not sure if you mentioned this, Vanjie, and if you did, I apologize for asking it again. But can you tell me a little bit about how folks in the community, especially those who might be providing care to family, friends, and neighbors, learn about all of these fabulous opportunities that you're offering?
Sure. I think that word of mouth is probably the biggest way because they're hearing from someone that's trusted. And so they're more likely to attend. And then once someone has come and experienced a training or a family night that we give, and then they tell their friends and it blossoms like that. But that doesn't always work. We do lots of flyers. We post them around town. We have a very active Facebook page that gives great article resources, but also tells about events that are happening, whether it's events we're doing or others. We have a newsletter that comes out monthly that we do. And then we were very lucky to connect with our BOCES and get this Flyer Connect app that gives information to communities, and our state early learning developmental guidelines are connected there. People can not only find out what's going on, but get some of that developmental information. And I would say those are probably the word gets out.
Thank you. And just for clarification, you used an acronym that I'm not familiar with. I think it was BOCES, and I wasn't familiar with that, and possibly others on this call are not. So could you tell us a little bit about what that is?
Of course. As I said it, I thought of that, and I see my friend Holly has already put it in the chat box. BOCES is the Boards of Cooperative Educational Services, and throughout Colorado, we have BOCES that are attached to school districts, and this is where a lot of professional development comes from, as well as special education services, therapies, gifted services, etc.
Thank you. And thank you, Holly, for helping us with that acronym. We all use acronyms so easily. I see that Sharon is saying that libraries also use social media, but word of mouth is best. And I'm going to come back to you, Sharon, to see if you do have anything more you would like to add about how you reach family, friends, and neighbors in your community that you haven't already added. Is there anything else that you'd like to add to us, Sharon?
Like I said, I think that the key for us is really realizing that depending on the size of the community, we have to use different strategies. And in rural areas in particular, where there's not a lot of childcare, they're actually reaching out to childcare centers and asking, who's on your waiting list, because that's who we need to contact. And that's been a very effective approach in reaching some of the informal caregivers, because parents who want to get their kids into formal care that can't because of the long waiting lists still can be identified in that way, which seemed sort of counterintuitive to me at first, but then has become a really brilliant strategy that we use throughout Colorado. Other ways of reaching that population, as I said, is like when we're out at events and we're giving away materials, that really does bring people over and get them interested and really pull them into understanding more of what we're trying to accomplish in terms of the Play, Learn, and Grow events and other events like that. And then we've also found, as I put in the chat area, that if we just call it a play, learn, and grow thing, it doesn't bring as many people in. But actually, one of the early childhood councils in a neighboring area in the southwest of the state, called this event, which was very similar to our event, but called it, getting your kids ready for kindergarten, and tons of people showed up. And so it really depends on what the priorities are in the community and what people are trying to do. And particularly in Colorado, this idea of kindergarten readiness is just kind of like so embedded into the culture that people will show up in order to help their kids to really kind of get the best fit forward in getting into school. So I think it's really important to know like what's going to really resonate for the people in the community, and promote it in that way, in the various ways that were mentioned with promotion.
Thank you, Sharon. Those are really great points. To really, the way we market the opportunities is really important, and to really know your community, know what's out there, know what's needed. I love the idea of looking at wait lists, and Lisa, thank you for adding those ideas in the chat room as well. At this point, I'm going to go back to you, Victor, if you don't mind, because there were a couple of questions about the Play and Learn groups. One question was about the curriculum. So can you tell us a little bit about what curriculum is used in that Play and Learn group, how you chose it, where it came from? And then we also had someone asking about how these 6 groups got started. And if you can give us a little bit of that information, it would be super.
Thank you for those questions. Yeah, so the curriculum that is being used is just emergent play-based curriculum. And in regards to the question about how the 6 groups got started, Maria did mention in the chat that the first 2 initial groups were funded through community foundation funding, and now the expansion and sustainability some funding is coming through PDG 5, so Preschool Development Grant.
Thank you for that information. That's very helpful. I don't think there were other questions for our panelists at this point, but if there are, please add them. Vanjie added that she forgot to mention, but they also give away books at their events as well, which is fantastic. You can never have too many books, right? And that food is an important piece as well. Food will bring people in as well. So now I'm going to go to the next poll and hear from some of you, although you've added a lot of wonderful information in the chat pods. But now I'm going to ask if there are other ways that your state, territory, or tribe is supporting quality. You can select many of these, and if there's things that you haven't already put in the chat that aren't up on our poll list, please add those as well. So I'll give it another couple minutes and then I'll share this with you and we'll talk a little bit about what we're seeing. Okay, thank you so much. It looks like a lot of you are talking about coaching. I'm delighted to think that coaching will go beyond regulated family child care. Hopefully that you're including family, friends, and neighbors in that coaching. And I know I've heard from many states that they are invited and welcome to participate in the professional development and training that is going on. Some of you are also offering incentives and doing some mentoring. And I do see that people are putting in the chat room a few other great opportunities, play groups in the malls and Barnes and Noble. I see that's great, great ideas and opportunities. There are opportunities to include family, friends, and neighbors in home visiting programs. That's a great idea. Thank you for that thought, Lisa. There's a lot of great thoughts in here. And Joanne is wondering which programs offer home visiting programs for family, friends, and neighbors. And I invite you all to add that into the chat pod if you know of any home visiting programs that are working with family, friends, and neighbors. That would be great for us. So thank you for that. So I now want to share, and I want to thank again our panelists from Washington and Colorado. You offered such great information. I cannot thank you enough. And I really want to thank our tech support people for being able to go back and forth to all of these panelists as we needed to. So thank you so much for all of that help. So now I want to share with you what we have found in our research in preparing for our webinar today, that although Washington and Colorado are doing some really fabulous creative strategies, so are many states across the country, and probably many of the states that are represented here in our participants. So the next several slides, and I'm going to spend just a couple minutes mentioning some of these to you, is sharing some information that we were able to find. And we added websites where we could. You will have access to this in a PDF. We will be sending this out to you, as I said earlier today, but in case you didn't catch it, we will be sending out a PDF of this PowerPoint, the link to the recording, and certificates of participation within a few days following our webinar today. So Sharon has shared more information in the chat pod as well. And Claudia mentioned the Arizona Kith and Kin project. And yes, we have that here as well, Claudia, so thank you. So we looked at 4 states here that have been doing some research and evaluation around family, friend, and neighbor through the Kith and Kin. We have Arizona and Illinois, Minnesota, and Oregon. So I hope you will be able to get more information from these. Obviously, I would have loved to have somebody from each of these states come and join our panelists, but then we would have been here for weeks and weeks, and we couldn't do that. So here's just some information about that. We also found that Illinois and Minnesota are really implementing some great strategies for connecting family, friend, and neighbors with each other, similar to what's happening in Washington with Play and Learn, and with library connections in Colorado. Illinois has a Town Square initiative where family child care professionals, whether they're registered or not registered, can come together. And Minnesota has some early literacy groups that they are supporting as well. There are also some states, and we've highlighted just 4 of them here, that offer opportunities for professional development that are specifically targeted at family, friend, and neighbor care. Minnesota has a toolkit that includes resources on topics such as home safety, health, and school readiness. New Mexico offers an 18-hour course in Spanish. Oregon Senate Bill 182 has directed Early Learning Division to support informal workforce, so they're sort of regulated to do so. And again, in Washington, there are reimbursements to offer training to licensed exempt providers, and I know Roxanne mentioned that in the chat pod a little bit earlier. And then the final group that we want to show to you is that there are many states, and we've only highlighted 2 here, that support participation in quality improvement systems through the Child Care Development Funds. So both Michigan and Pennsylvania are supporting family, friends, and neighbors to become regulated and participate in the quality improvement systems. So I wanted to share all of that. It looks like I see that South Dakota is also doing QRIS. Thank you, Jessica, for that information. I know that there are many states that we didn't highlight, and I apologize to any of you, but add it like Jessica did to our chat pod so we'll all know about it. And if you have any websites, please add the websites. That would be great. We would appreciate that. So I really want to thank everybody for all of your fabulous participation. I hope that you were able to get some new ideas and to support what you already knew to really add to everything that you are doing. I want to again thank our panelists for the great information. And now I want to ask a little bit for your feedback. So I'm going to pull up a couple of surveys to ask a couple of questions for your feedback. I hope you will take a few moments to do this before I show you the end resources. So we are wondering, how much has your understanding about family, friend, and neighbors either been improved or been supported as a result of this webinar? So please take a few minutes. We are not going to share the results of this, so please take a few minutes to add your thoughts. We really appreciate this, your thoughts and ideas. This helps us to do a quality improvement for our own webinars. So I'll give another few moments for this, and then I'll move to the next couple of questions. I'm seeing in the chat pod as well that a lot of you are adding states that have QRIS that are available to family, friend, and neighbors. So thank you for answering that question. Our next question is, how likely are you to use any of the strategies or the practices that were mentioned today? And before I move to sharing a few other resources with you, I have one more question for you. And this is a very open-ended question. Are there other webinar topics that would be useful to you? If you would just write it into this survey that just popped up on your screen, and don't forget to hit submit. We really take a look at your thoughts and suggestions as we are developing our webinars and our sessions for future conferences that we might be sponsoring and meetings. So I'll leave this question up for a few moments to hope people can submit in that survey. So thank you if you've submitted in the survey. If I move it away and you still have another idea, feel free to put it into the chat pod. So now before we go, I would like to just share a few resources with you that hopefully will be helpful to you. If you don't already know about the Infant Toddler Resource Guide that our network has developed, I hope you will consider looking at it. There's a lot of amazing resources in here for PD and TA professionals, for state level professionals, and for direct service providers, both home-based and childcare. There are many resources in Spanish as well. So I hope if you're not used to visiting this website, that you will start thinking about it. We also have a few other resources that you will see at the end of your your presentation that you will be getting. We still have just a couple more minutes, so if there are any final questions, please put them in the chat pod and we can answer them. Otherwise, Alexa, thank you for just posting the link to the Infant Toddler Resource Guide in case anybody wants to get to it before they get their PDF of this presentation sent to them. And I just want to, again, thank everybody who participated in making this webinar possible, our tech providers, our contributors to the development, to Deborah for facilitating, and absolutely for our panelists who were wonderful and gave us so much information. Thank you to everybody. We'll leave this open for a couple more minutes in case you have anything else you want to add in the chat pod. But otherwise, thank you so much for being here. I wish you well, stay healthy, and be safe.